Erectile dysfunction means difficulty either getting an erection or maintaining one until the completion of sexual intercourse. Erectile dysfunction is very common. Most men, especially those who develop cardiovascular disease later in life, are likely to get some degree of erectile dysfunction in their lifetime. As far as what causes erectile dysfunction, I always refer to the 4 horsemen of erectile dysfunction as high blood pressure, high cholesterol, smoking or a history of smoking, and diabetes. There are also some less common causes of erectile dysfunction, like low testosterone and side effects of certain medications. Erectile dysfunction is diagnosed by hearing your story. That might be that your erections aren't as hard as they used to, or that they simply just don't last long enough. Some men have already tried a medication, some men have not. There isn't necessarily a test that needs to be done to prove this. The way that erectile dysfunction can be prevented for most men is avoiding cardiovascular disease. That means keeping your blood pressure low, keeping your cholesterol low, not smoking, and not developing diabetes. Also, eating a healthy, balanced diet and regular cardiovascular exercise are very important. I recommend 45 minutes of moderate to vigorous exercise, meaning you're out of breath, 3 times a week. This has been shown to actually even reverse some erectile dysfunction. The benefits of seeing an erectile dysfunction specialist are that we are fully trained in all various treatment options for erectile dysfunction. These can include medical therapies, non-invasive in-office therapies, and sometimes even surgical therapies. There are a number of different treatment options for erectile dysfunction. The first thing that most men try are oral medications. But there are other types of medications, some of which can be inserted into the tip of the penis or even injected into the side of the penis. Then we have vacuum erection devices, constriction rings. There are even shockwave treatments, which are a non-invasive option that can be performed in the office. And finally, the penile implant, which is an outpatient procedure for the treatment of erectile dysfunction. In order to determine the best treatment option, I use a shared decision-making approach. I'll present you with all the different options and the pluses and minuses of each approach. Then, through conversation with you and getting to better understand your goals, we'll decide on a treatment together. The satisfaction rates for these various treatment options vary. For oral medications, the satisfaction rate is about 50%. For the penile implant, however, the satisfaction rate is over 90%. Now, all that depends on the individual patient's history, their likelihood of success for each treatment. So we always talk about all the different options and which ones we think might be most successful. Unfortunately, as the saying goes, if you don't use it, you lose it. And what you lose by not having erections for many, many years is elasticity or stretchiness of the penile tissues. This means that when the penis fills up with blood, after many years of not doing so, it may not be the same size that you remember it. Unfortunately, that's just a factor of aging for many men and erectile dysfunction.